Hi there, my name is Linda Salter, and I'm here at the Massage Therapy Clinic in Ingleside, Ontario. I am a massage therapist. Also, I'm the inventor creator of Butt-thotics. What is Butt-thotics? It's an orthopedic device that I've designed that helps people fix their back problems and a lot of other things. But first, we're just going to talk about that, make it real simple. It's a shim. So it comes in a cover. This is the bottom part of the shim that you sit on to the chair part. And this is the part that you sit your butt on. It's a wedge. I created this. It's a wedge that will help you level your hips in seated position. Okay, it's thicker in the back and it's thinner in the front. You want the thick part at the back of the chair. You sit it down and you sit on it. I'll show you right here. Okay, so you sit it down and then you go and sit on it and you see how it feels. You're going to know instantly if it works or not, if it's good or not. If it doesn't feel good or something's not right, take it off and put it on the other side and try that. And if you're in pain at the time, it's so simple. You'll know it right away and it's over. And if you can't tell because you're not in pain, wait till you are in pain to try it. Now, for some, it won't work. You really have to see for yourself. It's really not hard. I used to measure people's hips and then just give it to them. But what I discovered is that I could be wrong sometimes. It's not that easy. It looks easy, but it's not always easy. So I make people try it and then I watch for their reactions. And if you don't have pain, it's harder to tell because you don't have pain. But a lot of people, when they're not in pain, they'll try it. And when I take it out, they go, oh, I kind of feel crooked now. They realize, and some people already know that they're crooked when they're sitting or they're tilted. So what does it do? It levels your hips in sitting position. And funnily enough, nobody's ever done it. That's why I filed a USA Canada patent. I tried this on a client, and because I usually evaluate people standing up. I do orthopedic testing, where's your pain, blah, blah, blah. And this one girl, it was, I could never fix her. She came once a month, which is great. She's only 35, always sitting at a desk. So one day I just said, the heck with it. I evaluated her standing before postural assessment, and her hips were pretty level. So I couldn't really understand why she had such a low back pain. I always questioned that. So one day I sat her down and said, let's check you out while you're sitting. And that's when I realized you could be different standing and sitting. So we should be evaluating people both standing and sitting. So I realized she was lower on one side. So I put something underneath. And she said, oh, that feels better. And I was like, oh, well, that's great. So that stayed with me. I worked the rest of the day. As soon as I got home, I started researching, like I know what a lateral pelvic tilt is, right? That's when your hip from side to side is lower on one side than the other. It could be due to a leg length discrepancy. It could be due to the shape of the inside of your hip, all sorts of things. So by leveling that, you kind of take the strain off certain parts of your joints. But there's a lot more to that, because what does your spine house or protect? It protects your spinal cord and your spinal nerves. So I was having pain at the time. I've never suffered chronic pain, ever. I'm 53 years old. Apparently I'm lucky. I'm in pretty good shape. I could be in better shape, obviously. I don't do enough exercise. I do a little bit, but I work pretty physically. So I did start having, about 2 years before I discovered this, I started having a hip ache. It started a lot standing, and I know it was because I was working too much, not standing in proper position. I was always trying to find a good stretch for it. Never could get it. And it just felt like I always had to stretch. And I even looked up really funky stretches online, and I was always missing just to get that feeling of, oh, that feels good. So after her, and in the car, that was the worst for me. So after I treated her, I had 2 clinics at the time, so I got in my car to drive to the other clinic, and the pain started right away that day. So I said, the heck with it. I grabbed something in my car, a notepad, and I put it under my right butt cheek because I knew that my tilt was to the right. So as soon as I did that, the pain went away 100% instantly, just like that. So I was like, what the? And that sent me on a quest for the next 2 weeks. How come I've never heard of this? I looked up lateral pelvic tilt. I've never really researched it like more than when I was in school. You kind of know it's real simple. But for standing, you might shim it or you might not. There's a bit of controversy about that. Only if it's leg length discrepancy. Anyways, we'll get into that after. So as soon as I put this thin thing under my right butt, my pain went away instantly. What the heck? And all I could find for the next 2 weeks, I could not find a device like to help level the hips while seated. And all I could find on lateral pelvic tilt was how to fix it with exercises, which is great. I definitely recommend that, but it's not going to fix it forever. You get lazy, you stop doing it, and it comes back. If you want to get rid of it, you have to shim it. It's just like a house. When you get downstairs in the basement with those poles and you level the foundation, you're not going to take the pole out, are you? No. And then when you think, what's your roof going to look like if your foundation is crooked? Your roof's going to be crooked. Us too. So there's a lot to this. I'm not going to go into it today. I just want to show people how easy it is to use and what it's all about. It's just a shim for sitting. I've been researching this on people for the last 2 years, and oh my goodness, the stuff I've discovered, and it's sent me, like, at first I thought it was just for low back pain. Woohoo, I just invented something for low back pain, right? Well, no, because as I started testing it, it was for shoulder pain, low back pain, upper back pain, neck pain, headaches, even foot pain while seated. This is for seated. You've heard of the shim in the shoe? Fix your feet, fix your back. Well, what the heck are $500 orthotics going to do when you're sitting all day? You need one for your butt. Okay? People are using this everywhere. I've got students in school, especially you college students. Hey, you're at the desk all day. Wait till you find out what's really going on up here. And that's why I started this channel, because there's so much great information out there that nobody knows about. I don't know why. It's because there's no pills. It's easy to fix a lot of different health issues, because this is realigning your spine. Okay? What is inside your spine? A spinal cord. And spinal nerves come out the sides of it. Very important. We don't think of it that way, eh? I was taught all this stuff in school. I know the anatomy inside and out. But I was not taught to think this way. We are a moving structure. And if our posture or our spine is not sitting just right, we could be overstretching our nerves. We could be banging them around with bony prominences, because there's not a lot of room for error, especially up here or anywhere along the spine. It's easy to squish a nerve. And nerves don't just create pain, do they? They also, what can you do without a nerve? Nothing. You can't blink. You can't fart. You can't think. You can't do anything without a nerve signal to create that movement or that make that organ function. So what happens when you start damaging nerves because your spine's not sitting right? You're damaging the signals that are going somewhere. You have a big brain here. This is your brain, okay? You have your central nervous system, which is your brain stem, and your spinal cord. But then your spinal cord has all these peripheral nerves coming out of it, so you have your periphery. Now, the problem is at our neck level, I'll show you we'll switch this over. So right here, you have something called a foramen magnum. That's a big hole at the bottom of your skull. So you got your brain, that's your central nervous system, your brain stem, Then you have a big hole right here called a foramen magnum, and then you have the rest of your spinal cord. It's all one length. So if I went and pulled down here, I could actually pull your brain out of your head. And we're going to get into that. Then you have your spinal nerves, your peripheral nerves. That includes all the cranial nerves that come from the brainstem. Then you have the hole, and then your spinal nerves come off your spinal cord. And then right about here at L1, L2, it turns into your horse's tail. Right here, and then all these nerves here. So look, if your hips are uneven, what are you doing? I'm going to show you another photo here. Okay, you see that? You're going to be pulling all those nerves in. You're going to feel it all the way up to your head. And that's why Butt-thotics can help. By leveling your spine, you take the actual excessive stretch out of the spinal cord. And things will sit better so they won't be banging around. Anyways, we're going to get into that in the future. Please stay tuned and share this with your family because I know a lot of people suffer. It's not just about pain. Your nerves also split up and go and feed organs in your body. So Butt-thotics can help for pain. If you sit all day, you sit a lot, you have pain while seated, it can help. And it helps most people. But it's once we realign your spine, your structures will sit properly and protect those nerves and stop damaging or irritating them to let the signals get through. And that's what I'm going to talk to you about in the future. All sorts of things. And if there's this movement here, so if you're sitting at a desk all day and you're doing that, you can actually be pulling your brain out of your head or stretching your brainstem a little too much. Your brainstem doesn't like to be overstretched. I mean, if you do a stretch, that's great. It's 2 seconds. You do a big stretch, then you let it go. But in a stretch position for a long period of time, those nerves are going to deteriorate. And eventually, depending, it could get bad. All sorts of symptoms can happen. Basically, you're giving yourself a mild traumatic brain injury on a daily basis, okay? And that's what we're going to talk about in my next videos. But first, what is a symptom of a mild traumatic brain injury? And this comes from the CDC, okay, in the States. Symptoms of a mild and concussion. Why do they still know nothing about concussion? I will explain. Excuse me. Symptoms of a mild traumatic brain injury and concussion. Bothered by light or noise. Are you sensitive to light or noise? Dizziness or balance problems. Feeling tired, no energy, headaches, nausea or vomiting. Vision problem. Do you have blurry vision? Usually at the end of the day when you're tired? I know. Attention or concentration problems. Feeling slowed down. Foggy or groggy. Problems with short or long-term memory. Trouble thinking clearly. Brain fog. Anxiety. That's a big one. I know a lot of people are suffering anxiety. It's not just about the stress of what's going on. It can also be a structural thing. So anxiety or nervousness, irritability or easily angered, feeling more emotional, sadness, sleeping less than usual, sleeping more than usual, trouble falling asleep, and there's lots more. These are all possible neurological issues due to damage up here. What's a mild traumatic brain injury when you think about it? It's like a whiplash, eh? So if I do this and I go, what's happening to that brainstem in there? It's going through the foramen magnum, a big hole at the bottom of your skull. This is the back of your skull, and there is that hole. Whoop. How do I show you that? That's the hole right here, okay? Now your brainstem, you see that hole? Now your brainstem, whoop, I'm having trouble with this guy. Okay, so your brainstem, this doesn't look right, but anyways. Your brainstem belongs above this hole, but sometimes it can actually go down into it. There's too much stretch. That would be called a Chiari or tonsillectopia. We will talk about that. If you ever heard about that, you're going to want to stay tuned. That or basilar invagination or intracranial hypertension, or these are all mild forms, different forms of brain injury. And not only that, you could also have fluid dynamic problems. So you see here, That's a vertebral artery that goes right through your vertebrae. So if your vertebrae aren't sitting right, you could be actually occluding it. So you can get dizzy from that, and if not enough blood is going to your brain, your body automatically goes into anxiety. So when you're sitting there and for no reason you feel anxious, sit up straight for a second. See if it goes away. A lot of times it does. Anyways, these are just a couple of things I'm going to talk to you about. I want you to stick around. So try, if you don't have a Butt-thotics, I got a little hand towel here or something. Fold it up, because the Butt-thotics is only 6 millimeters. You don't want anything too thick. Try that on your chair, on one side, just underneath one butt cheek, and try the other side and see which one you like most. If you can't tell the difference, just wait until you have pain. You will know. And sadly, it doesn't work for everybody, but it works for at least 60% of the population. And if it doesn't work for you, it's because I know something's wrong up here. Or along the spine too, but mostly up here. And that's what we're going to discuss. So if you have a lot of different symptoms, you've been from doctor to doctor to doctor, you also have pain, Butt-thotics works. But stay tuned, because I'm going to teach you what might be going on and why you have acid reflux, because I fixed many things like acid reflux, blurry vision, ringing in the ears, some gut problems, a lot of stuff. So I don't want to make this too long. Thanks for hanging out. Stay tuned for the next one, okay? Thanks a lot. See you guys later.